Dr. Alex Earle, and this is the time I get to spend with you guys and talk about all your plastic surgery questions. And it's been a while, right, guys? It's been 2 weeks since my last live. Did you miss me? Because I certainly missed you guys. I'm so glad we're back. And it's now April. Can you believe it? This year is just zooming by. And so today we're going to talk a little bit about certain topics here, and then of course after that I'm happy to answer any plastic surgery related questions that you may have, which can be anything from like how to prepare to the procedure itself to post-op concerns as well. And for any procedure that you can think of or that you're thinking about from head to toe, okay? And you're getting good and reliable information because it's coming from a Duke trained, Ivy League educated, double board certified plastic surgeon. That's right. Okay, so today I wanted to talk about Pure. So Pure Plastic Surgery is here at the clinic that I founded about almost 7 years ago now. And so I wanted to talk about what is it that we do different? What separates us from the rest of the clinics down here in South Florida? And what is the value that we bring when you consider having a procedure here at Pure Plastic Surgery? So pure value, right? What is the difference here? And so I'm going to go over several things because it's not just one thing, it's multiple things. And a lot of them have to do not just with myself like as a surgeon, but actually a lot of them have to do with the team that we built here at Pure Plastic Surgery, which is truly an excellent team. I call it the A team because it's probably the best plastic surgery team in all of South Florida. These are truly people, these people are highly educated, they really know their stuff, and most importantly, they truly care about you, about the patients, about everyone that comes here. And you can notice that from the very first phone call that you make here at Pure Plastic Surgery. All right, so let's go over this. So what do we do different? All right, so let's start with the procedures. Well, what about the procedures? Yeah, of course we offer a lot of the standard procedures that you see in plastic surgery. So we offer your liposculpture, your high definition, your BBL, tummy tuck, breast procedures, etc. But what are some of the things that we do differently here? Well, one of them is certainly my own signature procedures, which now people have tried to copy or emulate, but of course, nothing as good as the original, right? So what are we talking about? We're talking about my Earle curve, okay? Creating the nice hourglass, smooth hourglass shape from the front, and my signature upside down heart shape from the back. When I first started doing this, nobody was doing that. Now it's kind of become a little bit of a standard. People talk about the upside down heart shape all the time, but this was my signature shape, the upside down heart shape there. And when you combine these things into a procedure, we have our very own procedure, our South Beach butt lift, okay? And what makes the South Beach butt lift different than your standard BBL? Well, there's a few factors here. Number one, it's the number and location of the incisions, right? So when you have a procedure, you really don't want anyone to necessarily know, or you don't want them to see like the telltale signs of the procedure, right? And so with the South Beach butt lift, we're going to be using fewer incisions, and they're going to be placed in areas that are very easy to hide, even if you're wearing a very small bikini out on South Beach. So that's number one. Number two, we want to make sure that it's tailored to your unique underlying foundation, right? And so all the transitions need to be nice and smooth, and it can't be anything that's like too overdone or exaggerated. It's something that just looks like it got stuck on and it doesn't belong, right? So we're gonna create nice smooth transitions. We're gonna make sure that for example, your thighs are able to handle the hips and the buttock and things of that nature to keep people guessing, right? So people are looking at you again on that small bikini in South Beach, right? And they'll be wondering like, does she have surgery? Does she not? I don't know. I can't see any scars or incisions, but who cares? Bottom line is she looks fantastic, right? And then of course, everything done under ultrasound guidance for your safety. As many of you know, I'm one of the pioneers in using the ultrasound for the fat transfer in the BBL. And to the point that this is now, due to our efforts, it is now the law here in Florida, where everyone who's doing a BBL must be using the ultrasound. And this has actually kept our patients safer, and there's been many less deaths here in Florida due to the use of the ultrasound, okay? So it's certain pioneers in that. So that's certainly one of my specialties. What are some of the other things that we do here different? Well, we do the trifecta perfecta. Is what we like to call it. Not a lot of clinics down here do that, but we combine your breast procedure with your tummy tuck and your arm lift all in one surgery done in a highly efficient manner. And if we have to, we can extend those incisions. We can extend the arm lift down into the armpit if you have excess skin down here. We can extend the tummy tuck if needed around the corner and things of that nature. So the trifecta perfecta, again, another procedure only here at Pure Plastic Surgery. All right. Okay, so that's about the procedures. Of course, we always focus on beautiful and enhanced natural results, and that's really our focus. So you can keep those results for the long term. We are, I think, as far as I know, the only clinic here in South Florida in which all of the surgeons are double board certified plastic surgeons. Okay, you don't have OBGYNs here, you don't have general surgeons, you don't have pediatricians here trying to do surgery or anything of that nature. We are all double board certified, and I should have written it here, plastic surgeons, okay? Not cosmetic surgeons, plastic surgeons. That means that every surgeon here has gone through an entire general surgery training and an entire plastic surgery training, all right? So Dr. Vidal, Dr. Wigriff, and myself, double board certified, every single one. Not only that, but we don't just talk the talk, we walk the walk. And we're always talking about patient safety, which is our number one priority. And really, what do we do different? We are considered the safest clinic, okay, in South Florida. Okay, and why is that? Because that is our number one priority, and we are not just saying that, we're actually certified by the Joint Commission, okay? So there's 3 levels, or at least 3 levels of certification. For an operating room, you have your baseline standard level, the level that you need just to be operating, which is done by the Florida Department of Health. Then you have something called Quad ASF, okay? And then you have the highest level of OR certification, that you can have, which shows the most extreme degree of safety measures for the patients, okay? And we have that, all right? And you can see it as soon as you walk through the door, you'll see our seal from the Joint Commission, or JACO. So almost nobody has this in South Florida, all right? What's next? We actually care about you. And again, we don't just talk the talk, we walk the walk. And so we offer CosmetAssure to 100% of our patients. That means that we actually provide this and pay for this for you, okay? That means that if you, for whatever reason, even in the low likelihood, happen to have a complication where you need to go to the ER or you need to go to the hospital, well, guess what? Your personal insurance is not going to cover it, okay? But CosmetAssure will, right? And that's why we provide that for you. We want to make sure that you have peace of mind should there happen to be any sort of issue or complication after the surgery. And again, as far as I know, I think we're the only clinic here in South Florida that provides this, okay?
Doc?
Yeah.
A lot of patients at TikTok says, I'm an Earle here and this is facts.
Yeah.
Hi, everything he's saying is true. I'm a past patient here. So a lot of patients.
Nice. Thank you so much for tuning in and for the support. And it is true, yes, these are all actually 100% facts, okay? And what else? I mean, it doesn't stop there. Like, even if we did, what if we just stopped it right here? That would be enough to make us hugely different from anyone out here, but it doesn't stop there, okay? We also provide concierge pharmacy services. So no longer do you have to run around to 5, 6 different pharmacies, CVS and Walgreens, trying to find your pain medication where they refuse to give it to you. They say they don't have it, or some other BS that they try to give at you, right? No longer you have to go on that scavenger hunt, which was driving our patients crazy before we had our concierge pharmacy services from the best, one of the best here in South Florida, which is PrivéCare. Highly, highly recommend them. Their service is absolutely outstanding. And guess what? When you walk out of here in your pre-op, you walk out with your medications in hand. We have this all for you. You no longer have to do that, very painful scavenger hunt looking for medications elsewhere. Okay. If you need additional post-op care, we can provide that. We have our great team at Med Miami, which provides excellent post-op care for you guys. So of course, we always want you to bring someone with you, right? But if you want additional help, we have Med Miami to provide post-op care. And if for whatever reason you can't bring anyone with you, then Med Miami can help you as well with their 24-hour service. Of course, that's going to be at a higher price point because it's 24 hours, but it can be done as well. And you know what's the great thing about this and combined with the hotel is that these are people that we know are going to take great care of you, okay? Because yes, I understand there are recovery homes out there, okay? But you have to be very careful in the way, in doing your research in choosing your recovery home, okay? We've seen a lot of recovery homes out there that, the people that are there are not trained, they're not nurses, they're not even medical assistants. We've seen a lot of issues where they overcrowd the space. We've seen a lot of issues where it's dirty, where there's increased risk of infections. A lot of them that don't even exist. You give them money and then you try to show up to the place and it doesn't even exist and you just completely got conned by some a-hole, excuse the word, out there taking advantage of you, okay? We don't want any of these things to happen to you. So we've, partnered with a hotel, the AC Hotel, which is in Dayland, a great place to be, only 7 minutes from Pure Plastic Surgery. And we can provide accommodations and we can combine that with your Med Miami care. And therefore we know for a fact you're going to be well taken care of. And that's definitely some peace of mind. And guess what? When you stay at the AC Hotel, you don't even have to worry about transportation. That's right. We provide that transportation for you. That means that you can get from the hotel to Pure and back for all your appointments, okay? And we have that covered. So no longer trying to find some, whatever outside transport or Uber or stuff like that where they may not take you, they may be uncomfortable, things of that nature. We have transport for you if you stay at the AC Hotel, all right? It's not like you're staying in your own place. All right, guys, I don't want you to get the wrong idea. We can't do that, unfortunately, at this time. But yes, if you stay with us at the AC Hotel, then we have transportation for you, okay? Yeah?
Important message, Doc. Just
Yes.
the most important message my surgery was today, and
Oh,
I'm
boy.
having my meds at post-op. It was top tier on YouTube, so she's recording right now.
All right, there you go. Yes. So yeah, and see how that brings you peace of mind, right? When you have your meds in hand already, when you have potentially, the Med Miami taking care of you, it really makes the entire journey a lot better when you know that these things are being taken care of for you, right? And of course, one of the biggest things that we have to do after surgery, especially liposculpture or BBL, is your massages, right? And again, for this, you need a professional, guys. You're not going to be going to Massage Envy for these types of massages, okay? You need someone who really has the experience, who really knows what they're doing. You need an expert in post-lipo lymphatic massage, okay? And we have our very own Bestie Genie, Jessica. She's absolutely outstanding. She's been doing this for years and years and years. Everyone that has her just loves her. And she provides massages here at Pure, but also she can go to the AC Hotel as well. And sometimes if you're not too far away, she may be able to go to wherever you're at. That depends a lot on her schedule and how far you are as well, okay? But the fact is that we have it all set up for you. We want to make this process as easy, as comfortable, and especially as absolutely safe as possible, because at the end of the day, we want to get you back to your families, right? We want to get you back home to your husband, your wife, your kids, your family, right? Because at the end of the day, that's what's most important. And so everything that we do is intentional. It's intentional in creating that safe and exceptional journey for you. Okay? All right. Woo! That's a lot. Okay?
And we have an incredible website.
Yeah, of course, you can't forget that. Actually, we have a lot of this information on there too. So if you have some information and you didn't pick up on the lives, you can go to the website. And all of our lives are also on YouTube. So you can go to Pure Plastic Surgery on YouTube, and you can probably find the answer to just about any question you can think of regarding plastic surgery. But talking about questions, let's go. Let's get it. Answer some questions right now.
What's the difference between a BBL and a skinny BBL?
All right, that's a good question, and you know what? Why? Because it's coming up a lot here lately. So we've been getting this question a lot, like what's a skinny BBL? What is a mini BBL? What is a South Beach butt lift, right? And so they're all, of course, variations on your standard BBL. What is a standard BBL? It's a liposculpture 360, so the entire trunk with fat transfer to the buttock and hips. So a skinny BBL is typically one that is done in the patient in the lower BMI range. Typically maybe a BMI between 20 and say 25. Usually if your BMI is below 20, you're not a great candidate for BBL because there's just not a lot of fat there. And of course, anything above 25, you're no longer a skinny BBL. So that's one of the main differences there, but then also what we've been seeing lately is also the style. The style has changed. So when people talk about skinny or mini BBL or even the South Beach butt lift, we're talking about a style where you're creating a little bit more of an athletic look, a little bit more of a look that is just what we like to call an enhanced or blessed natural look. And we're no longer going for kind of big, exaggerated hips or shelves or things of that nature, right? We want to make sure that everything flows nicely and that all the transitions are nice and smooth, okay? So that's when we talk about all of that kind of put together when we're talking about your skinny BBL.
What areas are included in a Lipo 360?
Great, so Lipo 360, 360 of course means all the way around, and so all the way around the what, right? So it's all the way around the torso. So that means the entire kind of trunk or torso area. So pretty much the entire abdomen, okay? The sides, so the flanks and the waist, and then essentially the entire back. What does it not include? So that's a follow-up question, right? So in men, if you're a guy, it does not include the chest, right? So if you have some level of excess fat in the chest or gynecomastia, that's going to be additional. And then it does not include what we sometimes call the buffalo hump, which is a hump that can be all the way up here. Not everyone has that. In fact, very few people have it, but if you do, that would be additional. Other additional areas are your axillas, your arms, your inner thighs, and your chin are other very common additional areas to your Lipo 360.
How do I get over the fear of surgery?
That's a great question. And what I've found is that fear has to do a lot of times with not knowing, right? Not being educated. And so that's why we dedicated a lot of what we do to educating our patients. And also fear becomes from not knowing like where you're going and who you're going with, right? So the two main points of social media and why I even do this in the first place is number one, to educate the patients, and number two, so the patients get to know me and to get to know Pure and our staff a bit better, right? And so when you know exactly what you're getting into, and when you know that you're going to have a team that's going to be holding your hand every single step of the way, and that there's communication here basically 24/7, and we can provide your post-op care, your stay, your transport, and everything else that you need around the surgery, well, that's going to decrease your anxiety levels, and it's going to decrease the fear of surgery, all right? And then, of course, when you know that the surgeon you're going to has a record of safety, of being pretty much the safest clinic here in South Florida, and that we really take your safety as our number one concern, that again is going to bring down those anxiety and fear levels as well, okay? So how do you get over it? You get educated, you get to know the people that are going to be taking care of you.
Patient says, when you meet Dr. Earle in person, he will settle your fears.
There you go. All right. I love the interaction. That's great.
The question was on Instagram and interaction on TikTok. And also she said, I had an extended tummy tuck in 2020 and I'm still loving my results. Your patient, doc.
That's great. That's awesome. And we love to hear that because we know that the patients are viewing this as a long-term investment, right? And that's the way it should be because it's a big investment, right? It's a big investment, and I'm not just talking like monetarily, but of course in terms of time, pain, recuperation, all these things that you're putting into it, right? And so when you're putting in such a large investment, you want to make sure that you can maintain that for as long a time as possible. And so how do you do that? Well, on my side, I want to create those enhanced natural results with smooth curves and transitions, because I know that's going to be a long-lasting type of result. And from the patient's point of view, you have to be able to maintain those results with what? Nutrition and exercise, right? And so the best combination is always the three of those, right? Surgery, nutrition, and exercise for beautiful, long-lasting results.
Question from Stacy.
Yes.
I had a tummy tuck by another surgeon.
Okay.
Can I come to you for additional surgeries?
Yeah, of course. You can certainly do that. And so we have a lot of patients that come to us who've had surgery or their first surgery or whatever elsewhere, and they usually come for can be a variety of reasons, right? One can be because you just want a totally different procedure. For example, say you had your tummy tuck, but now you want to do your BBL. And so BBL might be something that in the area where you had the tummy tuck, it's not very common there. People don't do it a lot because there's a lot of surgeons out there, especially throughout the US, that are they're scared of doing a BBL. Why are they scared? Because they don't have the experience, they don't know how to use the ultrasound and all the things that we do here, right? So very common, someone may have a tummy tuck and then come here for a BBL, because you know that I've done over 2,000 ultrasound guided BBLs and never had an issue with fat embolism or death, right? And so that is, you know, a very common reason. So sometimes patients come because you know, they're just not happy with the result that they got from the first surgery, right? And so we can try to fix that or reshape that or improve that, and that's another common reason as well.
Okay, hi. If I have hip dip fat transfer, will I be able to see it on my buttocks after surgery? And what's the post-op curve like? Thank you.
Yeah, so definitely, if all we're doing is enhancing the hip area, then yes, you can certainly sit, you can lay on your back, and that whole kind of sitting issue is not a problem. What you can't do, of course, is lay on your sides, right? So you're gonna have to sleep either straight up or straight down, but certainly not on the sides, okay? And you want to avoid anything that's going to put pressure down to that hip area. And the other thing I wanted to mention, since we're talking about hip dips, is that sometimes we get very skinny patients with hip dips. I'm talking now BMIs 20 or less, all right? So you have like a super thin patient, they have hip dips, they would like to just fill out the hip dip just a little bit more to have a smoother, kind of more hourglass shape, which is tough to do in someone who's very thin and who doesn't have any fat. And so for that, we now have a product that's called AlloClay, okay? And so AlloClay is essentially off-the-shelf fat. This is fat that we can get that's already pre-prepared. We get it off the shelf and we put it in the hip dip area to fill out and round out those hips, and especially those thin patients that don't have enough of their own fat.
Do you do bariatric patients? And if so, what's the BMI?
Yeah. So that is a great question. We certainly do bariatric patients or post-bariatric patients. So these are patients that have had some sort of procedure to lose weight, right? So you can, there's several ones out there, but there's like a gastric sleeve or a gastric bypass. And so what happens is that when you have these procedures, you lose a lot of weight very, very fast, very quickly. And we're talking. What's one of my favorite procedures with the bra line back lift. That's a great procedure to get rid of a lot of excess skin in that mid to upper back.
Okay, Dr. Earle. Mm-hmm. Do you do the BBL reductions?
Yes. Okay. Great question. So, not everyone does that. Actually, very few people throughout the U.S. do a BBL reduction. Okay. So first of all, like take all the plastic surgeons in the U.S. and out of all those plastic surgeons in the U.S., how many actually do BBLs? That's a very small percentage. Like I said, a lot of them out there are scared because they don't have the experience. They don't know how to use the ultrasound. Okay. And then of those, even a smaller percentage actually does a BBL reversal or reduction, okay? So we are one of the very few in the entire US that actually takes on these cases, and they can be challenging cases, all right? Some people call it a BBL reduction, some call it a BBL reversal. I like to call it a BBL reshaping, okay? Because a lot of times we're reducing a ton of volume, though we can do that if you need it. But a lot of times it's just kind of just altering the shape so it looks like something that is more of an enhanced natural shape and doesn't look like a fake BBL type shape. And so we can then go from, say, a squarish look to that beautiful upside down heart shape, or we can turn a heartish shelf into a nice pokey slope and things like that nature. And if we do have to reduce the hips, we can reduce the hips, and if we have to reduce the projection, the buttock, we can do that as well. One of the things to keep in mind that when we do these BBL reshaping, reductions, or reversals, is that a lot of times we have to treat the skin as well. So typically I like to combine this with some sort of energy that's going to help me contract the skin, which can be your vaser or your body type.
Okay, do you need to stop GLP-1 medication prior to surgery?
Definitely. You definitely want to do that. What is GLP-1 medications? For those that may not know, but you've probably heard these names. It's your Ozempics, your Mounjaros, the medications that are now super popular that are helping people lose a ton of weight. I think these are great medications. They work probably just as well as bariatric surgery with a lot less side effects and downsides and risk, okay? But how do they work? Well, one of the ways that they have several mechanisms, but one of the things that they do is that they delay gastric emptying, meaning that the stomach empties slower than it would otherwise, and that makes you feel full, so you eat less. But when you're talking about anesthesia, specifically general anesthesia, having a full stomach is a problem, right? So that's why they ask you to stop eating and drinking at least 8 hours before you undergo general anesthesia. So when you're on these medications, you have to stop that medication, I would say a minimum 2 weeks before surgery, though we like to be extra safe. So typically we tell our patients 30 days before surgery, but certainly no less than 2 weeks before surgery.
Would you please tell me what's your BMI limit? I want to go for Lipo 360.
Okay, so my BMI limit for Lipo 360 in BBL cases is max BMI is 30. Okay, so max BMI is 30. I think that is a safe BMI because as you start getting above 30, then the complication curve starts doing this. Okay, so as you go above 30, complication curve starts doing this. And so when you have the BMI of 30, two things. First of all, complication rates are lower, so therefore safety is higher. And you typically are going to have a result where you can really notice the difference and enjoy that result for the long term.
Okay, how long does it take a BA? Breast augmentation.
For me, I love that surgery because I am super quick. I am super fast with this. Yes, I could do a breast aug in under 30 minutes. Skin to skin, as surgeons say, skin to skin, less than 30 minutes. Usually about 25 minutes or so. So very quick surgery. I love this procedure because you have almost like an instant result in a very quick surgery with very happy patients. And the recovery is not bad. Yeah, you're going to feel some pressure. You may feel a little bit of pain. But most patients don't even require narcotics. They'll be okay with some Tylenol or Advil after the procedure. All right. Is that it? 30 minutes already?
30 minutes, 5 seconds, and counting.
All right. Excellent, excellent. Whoa, it blew by really fast today. I missed you guys. So yeah. So next week, we're going to do this again. All right. If you have any specific topics that you want me to talk about, please send that to us. You can send it to us in our DMs and just let me know. And I'm happy to try to set up a discussion like this around that topic.
A lot of people is asking about anesthesia.
Anesthesia? Okay.
Yes, sir.
I think that's a good idea. All right. So next live, guys, tune in. We're going to be talking about anesthesia. All right. All right. So I'll see you all next week on Hump Day with Dr. Alex Earle. Take care, everyone. Ciao.
Awesome, doc.